Hi, my name is Harriet or Heraclea Proyos. I'm an associate professor of cognitive neuropsychology, of cognitive and neurorehab at the University of Macedonia, Department of Educational and Social Policy in the University of Macedonia in Thessaloniki, Greece. And it's my great pleasure and honor to be invited here to the Esoc 2022 Angels Symposium. I'm here with Kalliopi Tsakpounidou. Let me tell you about this program. This program has been realized and performed by the Angels Initiative and BI, and a special thanks goes out to Jan van der Meve and Thomas Fisher and their team at BI for trusting us with this incredible project and all of the guidance, support, and leadership that they've shown us throughout this program and this project. I'm going to start interviewing Kalliopi Tsakpounidou now. Can you, Kalliopi, tell us a little bit about the Fast Heroes educational program?
Gladly. So the Fast Heroes is a school-based stroke educational program that aims to educate young children and their extended families, especially their grandchildren, their grandparents, about stroke symptomatology and the appropriate response to it. It was developed by the Department of Educational and Social Policy at the University of Macedonia in Thessaloniki, Greece, in collaboration with the Angels Initiative, Boehringer Ingelheim.
Great. And can you tell us how many countries and worldwide have implemented this educational program?
As for now, the campaign has been implemented in 14 countries around the world, namely Brazil, Bulgaria, Canada, Greece, Hungary, Italy, Lithuania, Poland, Portugal, Romania, Slovakia, South Africa, Spain, Ukraine, and United Arab Emirates. It has been adapted to 11 local emergency numbers and translated in more than 37 languages, as more countries have expressed interest in implementing the program, and more are expected to follow.
Yeah, there's always room for more, that's for sure. And in the future, I'm sure you plan to expand and look at sustainability of this program as well to the countries that already have run the program.
Of course, we are currently working on collecting more data in the upcoming implementations.
Great, great. So what have kids learned from the program?
So, children have learned how to recognize the 3 most important stroke symptoms and how to reach out for help by calling the local emergency number. Each country has a different local emergency number. From a published study performed in Greece, we found that over 74% of children could recognize the 3 stroke symptoms after their participation in the program. They also learned how to respond appropriately in case of a stroke, maintaining this knowledge even a month later. However, the most important component of this project is not just kids acquiring this information, but kids' enthusiasm to share and spread this knowledge with their loved ones and their family and family members. So through children, we aim to disseminate important information about stroke to older adults and especially to grandparents. We aim to raise awareness within the community, where people will be ready to identify a stroke symptom and reach out for professional help by contacting their local emergency number and getting medical treatment immediately.
Though it's great that you're targeting grandparents, that we're targeting grandparents with this program, because they're the ones mostly affected by stroke. We know that about 74% have increased probability of having a stroke. And so the seniors are the ones that are taking care of the grandkids most of the time, or whether they're grandparents or grandaunts or granduncles or whatever, extended family. And so the program really targets extended families. That's exactly what you said.
Yes.
That's great. That's great. Can you tell us what kids have learned so far?
So, yeah, we have developed an educational program that has 5 weekly 1-hour sessions, and it incorporates different activities such as music and dancing and animated videos, and kids have learned to incorporate all that into their learning.
Okay, and they've learned how to call an ambulance and call for help when needed in an emergency.
Exactly.
Absolutely.
Yeah, through role role-playing activities. Children have learned and practiced how to call an ambulance. And this is very important because children usually are not aware of emergency situations, so they practice with us how to do that.
Right, and the public generally doesn't know enough about stroke symptomatology, so I think this is a great way to target the public and get young children to teach trickle-down effect and be conduits to their extended family. Wonderful. Have parents also learned, and have you assessed that knowledge, that parental knowledge?
Yes, so parents learned through incidental learning through their children the three most important stroke symptoms and the appropriate steps that need to follow a stroke. Parental knowledge was evaluated through an online assessment, the Stroke Preparedness Questionnaire. The questionnaire was given to parents in 3 phases, that is, before the implementation, immediately after the implementation, and 6 months post-program implementation. Our results from the global research show that more than 4,200 parents have been educated with the Fast Heroes campaign. Before their participation, 55% of parents could correctly name all 3 stroke symptoms. Immediately after their participation in the program, 79% of them could correctly name all 3 stroke symptoms, and this knowledge was retained, but not only retained, it was increased after 6 months post-participation, up to 94% on a global scale.
That's amazing. That's wonderful. That's wonderful. And we've just been through a global pandemic. So how was the program implemented during the pandemic? From what I understand, it was somewhat a blessing in disguise because there was also a digital aspect to the program.
It was. So before the pandemic, the program was implemented face-to-face in schools, in educational institutions, by a group of educators. During the pandemic, a modified digital education portal was created, and we designed 5 interactive online books that can be used both face-to-face and digitally. Now, a hybrid multimodal version of the program is used both physically and digitally. In fact, this work just got accepted in the International Journal of Health Promotion and Education, and we're happy to share the results of this digitization process.
Great, and hopefully we'll have more global results coming in the second wave. So the program is still ongoing?
Yes, the program is still ongoing. We are currently, as I said before, we are currently working on collecting more data from the upcoming implementations, and hopefully more countries will join us and will be enrolled, and schools from all around the world will be recruited.
So So can you tell us a little bit about what parents learned, or what were teachers' perception about the program?
Yeah, so teachers overwhelmingly supported the program. They agreed, they strongly agreed that the program can help save lives, that the children enjoyed taking part in the campaign, the materials were excellent, and they have also gained trust in themselves on how to respond to such an emergency. The majority of parents supported that their child understood the message communicated through the program, and that their child passed on the message to their extended families and to their grandparents.
And I understand recently that the grandparent data is out there also, and grandparents showed the same kind of enthusiasm and amazement in the information they received.
Yeah, so we are pleased to announce that a paper has been accepted also for grandparents implementation, and we have results that parents' knowledge has been increased also. And,
grandparent knowledge, yeah. Great. So I'm sure there are regional or country differences within different countries, and we always deal with these inequalities, and especially after training with Fast Heroes. How did you deal with these differences in different countries? How did the program deal with it?
So there were indeed regional differences among the various countries that implemented the program, and this can be attributed to different socioeconomic as well as education levels across the countries. One example is that countries that have better stroke service of care had more parents that were more knowledgeable in terms of the response to stroke. Cross-country variations were observed among parents who indicated that they would call an ambulance in case they would witness a stroke symptom in relation to all three stroke symptoms. So this was after the campaign was implemented, and the results showed that the correct answers from parents fluctuated between 54% to 77%. However, this issue merits attention in future studies and in future implementations.
Absolutely, and I think this is something that Esoc and serving as a safe president now, we see socioeconomic differences and regional differences throughout all of Europe, and getting stroke on the agenda, on every political agenda, is very important. Even more so, getting stroke education to the very young is even more so important, so that they can disseminate that information to the wider community and be good citizens. So parents and teachers are excited about the program globally?
Yes, and we are getting more and more feedback from teachers saying that kids loved it and they are very excited about implementing the program, and they want to implement the program in the future school years. And we are very happy because this is what we aimed at from the beginning. We aim to not only educate children, but also spread this knowledge through incidental learning to their parents.
And so I'd like to send out a special thank you. I'd like to send out a special thank you, and thank you, Kalliopi, to the interdisciplinary team that worked on this program from the University of Macedonia, a bunch of teachers, educators, and so on. And also, of course, BI and Warner Studios, who did a wonderful job with the animation. And also the most talented voices and agencies, consultants, they all come together once a month, or twice a month now. It started once a month. And to meet, to discuss, to problem solve. And definitely, it's not a sprint, it's a marathon. And we'll keep training and educating until all children become superheroes and agents of stroke care. Thank you for being here today, everybody, and thank you for everything you do for the Fast Heroes program, educational program.